How's it going? My name is JMcAuley. I'm currently a doctoral student at North Central University in the Marriage and Family Therapy program, specializing in therapy with military families. Um, Throughout my coursework with a trauma and resilience in military and veteran couples and families course, I've developed and put together a resource guide. The purpose of the resource guide was to gather various clinical assessments which are being utilized by mental health professionals, such as marriage and family therapists, in treating veteran military couples, families, when it comes to treating them for trauma or as a result of a trauma they have experienced. The resource guide provides a description of each assessment that I've put together, psychometric data on it, and outcomes of each of the assessments specific to trauma that we may see with a couple that's sitting in front of us. Together, there's about 23 measures, 23 assessments that I put together, and they vary from topics related to PTSD and trauma, marital, relational satisfaction, depression, substance abuse, moral injury, traumatic brain injury, and suicidality. So the value of the guide itself, clinical assessments can be an aid for us working with our couples throughout our therapeutic journey with them. It can help us measure symptom reduction or an increase of symptoms throughout our work. It can assist and aid us with treatment planning, and it also is a way to increase our clinical competency when it comes to working with military and veteran populations. So whether it be there individually or as a couple or as a family. So throughout my work and putting the guide together, I came across a few studies and a few key findings in my work. One of them was related to the increase of PTSD symptoms, which were broken down into 4 clusters of re-experiencing, hyperarousal, avoidance, and emotional numbing. As those increased, the relational satisfaction in the couple decreased. As emotional numbing increased, relational satisfaction, relational functioning decreased. As a spouse's avoidance of their partner or the veteran's avoidance, it decreased their satisfaction with each other and decreased positive bonding. Hyperarousal, as it increased, it also increased the relational conflicts. So OIF, OEF veterans, so Operation Iraqi Freedom, Operation Enduring Freedom veterans, 1 out of 3 utilized mental health services within a year of returning from deployment, which was a great study done by Hogue. And then we look at, dependent on the military or the veteran couple, whether it's 1 deployment or more than 1 deployment, it may or may not have a significant impact on their relational satisfaction. So it kind of gave you that feeling that it may depend on the couple and it may depend on their experiences leading up to that point. Combat exposure was a strong predictor, especially with depressive symptoms amongst female veterans as opposed to their male counterparts. Female veterans, pre-military, during the military, and post-deployment, post-military, had experienced more trauma, and male veterans had experienced more combat trauma. When it came to moral injuries, when veterans were, when there was a decreased or lower level of making meaning of the stressor or what they had, that moral injurious event, as that was decreased, there was an increase of PTSD, depression, suicidality, and relational satisfaction. There was an increase of mental health problems with spouses or partners that were related to their veteran or service members' PTSD diagnosis, longer deployments, and if they had a long deployment that was also extended as well. One of the things that we saw, that I saw going through the studies related to putting the resource guide together with those various topics were there was also the ripple of a deployment and combat exposure was not just to the veteran or the military service member. It was also to their spouse, to their partner, to their children. It impacted their physical health, their overall well-being, their emotional health, their mental health. Traumatic brain injury, it's dependent on the veteran themselves. So you may want to look at some of the screening tools for that and see if there's any impact to their memory or verbal fluency, which some studies have reported. But the neurological functioning will vary between veteran to veteran and the exposure to the traumatic event. So, in terms of suicidality and the the PHQ-9 and the PHQ-2, the patient health questionnaires, 1 out of 3 veterans screened positive for suicidality, and if there was a diagnosis of PTSD, schizophrenia, depression, bipolar, it increased the likelihood of that suicidality. So those were just a few of the findings that were very important or salient throughout my look through the data and the different studies that I put together for the resource guide. I'm excited to put the fine tuning on it this week and get it to you. So thanks for your time. I hope you have a great week.